Welcome to another episode of Management Muse. I'm your host, Cindy Baldy, and this is my husband and co-host, Jeffrey Tumlin.
Yellow! Welcome to the podcast where we try to inspire better work performance. Thanks for listening.
Hello, Musers. Today is a mini episode. This is an outtake from our turnaround episode with Rhonda Mundhenk, Chief Executive Officer of Clinical Health Network for Transformation, otherwise known as CHN. We took this material out of the main turnaround episode because it was a little different from the rest of the episode. We asked Rhonda to switch from her own experiences and lessons learned to what she would do about American healthcare, theoretically speaking. So we wanted to pull that out on its own. Here are some of Rhonda's thoughts on American healthcare.
Let's say the President of the United States said, Rhonda, I hear you're awesome at turnarounds, and I want you to help me turn around American healthcare. What would you do? What are the big forces at play? And if you were going to try for the good of our society to turn around American healthcare, what would you do?
Well, I wouldn't do healthcare.
Okay, fair enough.
I think I would work on the things that drive health at the end of the day. I think the American healthcare system, and this is not a new critique, the American healthcare system is very much focused on the tertiary quaternary.
Okay.
This is where we spend our money. This is what happens after people are already all messed up and need lots of fixing with lots of expensive things. And the reality of it is that you have other systems of healthcare, not to say that they're, not resplendent with their own issues, because they are, but there are other systems that certainly spend far less than we spend, which is what everybody complains about, how much healthcare costs, and keep their overall populations healthier. And the way that they do that is with their social investments. So if you look at what their social investments are, they're investing socially, which are the drivers of health. And then the second thing that they're really focusing on is prevention. So they are focusing outside the things that create health status. If you look at the healthiest nations in the world, that social quadrant is where they're spending their money. And I think that's clearly something that the United States needs to look at. And then the secondary aspect is just your preventative care, ensuring that the people are getting the best preventative care that they possibly can. Then certainly there's things that happen. Car accidents happen, plane accidents happen, all kinds of things happen that require these higher level services. But we're allowing people to sort of blow through social investment, preventative investment, primary care investment, and hit the back end of healthcare with all of the bad things already, with all of the diabetes, with all of the hypertension, with all of the heart disease, with all of these things, and then expecting to spend our way out of that. And it's ludicrous.
Yeah. So
it's a ludicrous way to organize a health system.
Yeah, so it would truly be a turnaround if you were in charge, meaning a change in direction.
Yeah, so I mean, I think, I think you have to, it's your approach to healthcare. Okay. Do you want to fix disease that could have been prevented? That's what we do now. We like to fix disease, or we like to manage. If we can't fix the disease, then we like to manage the disease. At the end of the day, that's what we like to do in U.S. healthcare. And so there's that focus. Or do you want the disease to have never happened? Do you want people to have the social inputs that throughout their lives that lead to better health status? So it's either, do we want to create health? That's a different question than the U.S. healthcare system is answering now. Predominantly, the answer that the U.S. healthcare system is saying now is we want to treat disease. We want to treat morbidity. We want to manage through to either, we want to treat morbidity or people die. That's kind of where the U.S. health system is stuck. And the question is, if we're really talking about health in its totality, do we want to create health? That's a different question. You do different things when you're trying to create health than managing disease through to, penultimate conclusion of death. But that's everybody agrees that the U.S. system costs too much. There's not a person on the planet that will tell you, or maybe there are, but there's not a lot of debate around the fact that this is one of the most expensive and most ineffective healthcare systems that exist out in the world today. But again, it comes back to that fundamental question of, all right, well, are we going to treat disease? Or are we going to manufacture health?
Yeah.
Two totally different things. I've been in healthcare for a long time, so as I critique the U.S. healthcare system, I recognize this is also a critique of my work. It's fine. But as I think about the future of healthcare, the things that draw me, the things that move me, the things that really sort of light me up are, how do we get to that question? How do we start asking the question about health? And more importantly, as we ask that question, how do we make sure that investment is equitable across sort of everybody that lives in America? So I'm at the stage now where I think, that my career has allowed me to begin to answer or ask that question with meaning and significance, and begin to think about what potentially that looks like. But if that were what I were doing, that is what we would think about. It is an interesting argument, obviously, because our national struggle right now over social investment shows that, it's kind of it's one of those arguments that when you sort of look at it, you can see a real divide in terms of what people think people should have to live at the end of the day. And it's not very much in the U.S. equation. We're arguing over stimulus checks, and, I'm not an economist, but I know that it wasn't very much money in the grand scheme of things. Yeah. And, so I think that's stuck. That social investment sector, what other countries have done and invested in, is very interesting, because when you look at international health, this is absolutely connected. Yeah, like there's not even a question. Right. When you look at the sort of logic and prevailing theory of international health, if you ask sort of what fundamentally is that built off of, I'm going to tell you what it is the health of women and children. Like, I'm simplifying. Yep, right. But it is the health of women and children that actually determine the well-being, including the economic well-being of that nation. Yeah. And that is how international global health is built. Yep. So why do we believe it in that context, but we don't believe it in our national context? Why do we not believe that children growing up, below the poverty level? Why do we believe that in the international context, but we don't believe that in the U.S. context? Like, that sort of stuff makes no sense to me. But I do feel like I am, getting to the place where these are the things that I get to think about, and hopefully, do things about. And certainly throughout my career, that's been a thrust and focus. That won't be a surprise, I think, to anybody who's looked at the things that I've done. But when you think about the U.S. healthcare system, that is the fundamental question. Are we treating disease, or are we trying to manufacture health? And therefore, where should we spend? Where should we spend our resources?
We hope you enjoyed this episode. If you want to learn more about the topic, check out our show notes. And if you want to help us out, like, share, subscribe, and 5 stars are all deeply appreciated. See you next time on The Management Muse.